Psychiatrist Dr. Sue Varma is here with how to manage your fears about the coronavirus. Good morning. Did you expect this? Is this taking you by surprise? And what can folks do to alleviate some of these concerns?
Yes, so this level, definitely I am surprised. And I understand that we need to have emotional insight and awareness. I think that the anxiety disorders come because we're contending with a war on two fronts. One is with the cognitive distortions that are in our mind, and one is with the external reality. And in my practice, what I'm finding is that developing this approach, which I like to call practical philosophy. Practical is what can you actually do?
Right.
And the optimism, practical optimism, is about how can we change and challenge some of these negative distortions.
Is that what you call a productive way to worry?
Exactly. So a productive worry is what can I do? So I'm finding that telling people to pick one reliable news source, whether it's the CDC.gov, whether it's this show.
I was going to say, it's CBS News
Yes,
for
exactly.
those watching at home.
Exactly.
This morning.
And then limit the level of intrusions. We're getting a lot of intrusions onto our phone. We don't need to know a minute by minute. And also I would say is ask yourself, what is happening locally? Yes, we want to know what's happening in China and what's happening in Italy, but what is happening in your local school systems? To me, that's the most important thing in terms of the preparedness.
Yeah.
This uncertainty is particularly troublesome, isn't it, for people who already struggle with anxiety?
Exactly. And you know, one thing what we're finding is first we were seeing that the things that were going off the shelves were the masks, the hand sanitizers, and guess what? Now it's toilet paper.
Right.
Why? Because it gives us something to do. We're finding that, you know, all of these stores are running out of supplies because of the anxiety that we are projecting, the catastrophizing, the what if thinking, the ruminations, right? Instead, we need to say, what can I do? How can I separate emotion from fact? And that's the most important thing, is dealing with the facts here.
Yeah, how do we talk to our kids about this?
Yes, so kids need to be reassured by the parents. First of all, have age-appropriate conversations. Let them lead, see where they're at, see what their fears are. A lot of times we're getting sort of what we call stress contagion, where the parents are putting their anxiety on the kids. Kids like to be productive. They like to know facts like, okay, this is not hitting the children. Who is this hitting? Who are the most vulnerable people? It's not the kids here. It's the elderly people who are immunocompromised or who have multiple medical conditions, who are exposed to recent travel, who are going on cruise ships. So letting them know the context that yes, there is a virus. You play a part in this by washing your hands, singing happy birthday 2 times, 20 seconds. So the kids may have the virus, they're not exhibiting it, but they could be passing it along.
You're not likely to get sick, but your school may get shut down.
Exactly, yes.
Yeah.
And then having a plan with them. What are we going to do? Just the way parents have to think about during the summer when the kids are home. Are you going to have screen time? Are you going to have books? Are you going to have games? Who's going to be the caretaker?
How about service to community?
There you go.
That's what my son's doing.
Alternative spring break.
Absolutely.
Like
You know, people can sometimes get through a virus with enhanced immunity. I wonder, when you're dealing with this from an anxiety point of view, getting through this, could you have kind of immunity to this sort of event going forward? Is there a silver lining, in other words?
You know, I love that question because when I think about the 4 M's of mental health, mastery is one of them, right? In addition to mindfulness and meaningful engagement and movement. But mastery is not about what you're good at, it's about what you've overcome, right? And as a former 9/11 medical director, resilience is something really important, and post-traumatic growth. So what can we learn? How can we come together, and how can we be stronger as a result of it?
Can some anxiety be a good thing?
Yes, absolutely. Anxiety is normal, and anxiety helps motivate you. It helps park your resources. And the first question for me is anxiety is, what information do I need, and how can I move forward from this? So you need to recognize the emotional aspect, get help, talk to your therapist, have a support system. If you need to do more FaceTime, we're not getting to have as many in-person interactions, especially if you're sick or you're self-quarantined or self-distancing. But don't stop the support system that is so important. We need help more than ever before.
Yeah, yeah. And be sympathetic to one another. Don't just say, calm down.
Yes,
Yes.
right. Exactly. It's very dismissive. Yeah.
Dr. Sue Varma, thank you very much.